Hi, everyone. Welcome to this week's edition of the CHP Spotlight Interview Series. Today, I'm really excited because we have Dr. Jamie Grossman joining us. And Dr. Grossman and I have gotten a chance to know each other with our new McLean facility. And it's really been just pleasure working with her. All our patients have had amazing experiences. So I reached out to her and I said, hey, I think our audience would really love to hear from your expertise and what so many of patients that we've been working with on the Virginia side have been able to benefit from recently. So, Dr. Grossman, really appreciate you joining us today.
Well, thanks, Zach, for having me. It's been really great working with you, and I know my patients here have been very happy with the care at your facility in Virginia. So, thank you.
Oh, absolutely, absolutely. And so to get things started, some instead of me just describing what you do, I'll probably miss a part or something. So, in your words, Dr. Grossman, tell us a little bit about, what you do, the types of patients that you typically help, and the things you help them with.
Sure. So, I am fellowship trained in sports medicine and hip preservation and joint reconstruction. My fellowships were at University of Pennsylvania in Philadelphia, and then I also spent some time in Vail at the Stedman Clinic. So I primarily do sports medicine. I see patients for ankle, knee, hip, and shoulder, and ages range from kids. So I treat pediatrics to adults who are living their retired life. So I pretty much see anyone in between. And so my specialty is really focused on hip. I do see all of sports medicine, but I see hip pathology ranging from hip dysplasia and labral tears or femoral acetabular impingement to hip arthritis, and I treat everything within the hip.
Gosh, it's super helpful to know. And then, as you know, a lot of our audience tends to be weekend warriors, I would describe it, and a lot of high school youth athletes. So I'm curious, amongst like those particular active populations, are there any injuries or complaints that you tend to see more of than maybe some other issues?
Sure. So, particularly for the weekend warrior, I see a lot of ligament and tendon tears. More in the adolescent adult population, kids tend to break their bones rather than tear tendons, and that's just because that's the weakest link for them.
Mhm.
So, when I've seen a lot of kids with ACLs and Achilles tears, or adults too, and so that's something else I treat are ligaments and tendons. And then I also focus on sometimes you can get a cartilage tear or meniscus tears from your weekend activities too. So I'll see people for those also.
Gotcha. And I appreciate you sharing that. And I know you mentioned a few different things. So, I know there's obviously some different risk factors in each, but could you, I guess, shine a light for people out there watching this on, I guess we could start with like the meniscal issues, and you mentioned obviously Achilles issues, and then obviously any of the more common hip issues amongst that active population. What are some, and I know that some of these might overlap, but what are some of the risk factors that you often see to maybe being a little predisposed to something like this happening, from your experience?
Sure. So typically, patients I see with upper extremity injuries over the weekend, they will have weak scapular stabilization. So that's important to focus on for like your rotator cuff and the muscles attached to your scapula to strengthen those. And then for lower extremity, it tends to have a common core, which is a weak core, and pelvis muscles. So I think that strengthening those is important and helps prevent injuries down the line of your leg.
Gotcha. And I appreciate you mentioned that. And then, is there anything? It's funny. Always there's so much like content and stuff out there, whether on the internet and things you can find these days. And I know sometimes one of the things I know for me, certainly in many different areas, it's hard to almost have that like part of my French, kind of like that BS meter, if you will, of knowing, hey, what's worth my time, what's not. So, what are some in that vein? What are some things that you wish the public knew about the ways they could possibly help reduce the risk of some of the common injuries that you see most often?
Sure. So for, short and sweet, I'll say that just because you think you can doesn't mean you can.
Okay.
But no, I mean, in all honesty, I would say try to stay active throughout the week. Typically, the patients that get hurt the most are the ones that aren't active and then haven't been active for a few months and go play a soccer game over the weekend. So just because they feel good doesn't mean that they're equipped to run for 90 minutes or, play a competitive game. And so you end up getting hurt because you're compensating for other weaknesses.
Gotcha. Well, it may certainly make sense. I know we see a lot of people when they come in with these injuries, and when you ask a few questions, you realize, oh, I've been mostly at the desk all week, and then all of a sudden on Saturday, now I decided to play my adult league basketball game that I haven't joined in about a month. And all right, well, this sometimes the simplest solution can be the best one. So that makes a ton of sense, and I love that perspective also that you see that same thing as well. And let's say I guess I'm one of those weekend warriors now, and or we're the parent of a youth athlete. How do we know whether or not we should come in to see you versus just kind of just resting it and it'll go away sort of thing?
Yeah. So typically, if your pain is increasing after the first few hours, 6 to 12 hours, and you're resting, you're icing, you're using compression and elevating, so the common rice, and it's not getting better, then you should probably come in. Obviously, if you have any gross deformities, if you hear pops or cracks during the injury, then that's something to come in for too. But basically, if it's not getting better with rice for about 12 hours or 24 hours, then I would come in and get seen.
That's super
Um,
helpful. Oh, sorry, go ahead.
no, that's fine. I was just going to say, so over the weekends, if you do get injured, I also see walk-ins on Mondays, which is why I've been seeing more of the weekend warrior athletes here at the McLean office.
Sure. Literally by definition, the weekend injuries. um,
Yes.
yeah. Well, I love that. And first off, like that's huge to be able to do see walk-in visits. I know like personal experience for my own silly injuries I've had after my college athletic career and even during it is, hey, anything that happened on a weekend, it's sometimes tough to see somebody that can in a timely fashion that can help you. So just knowing you have the walk-ins on a Monday, anybody watching this, like I can't tell you how challenging that can be to get in that quick. So that's really big stuff. And one thing you mentioned early on, Dr. Grossman, was you mentioned hip preservation. Now this might be my inner nerd kind of coming out and getting excited about stuff, but can you, for people listening, can you tell us a little bit more about what exactly is hip preservation? What types of things do you do to help people preserve, I guess, the health of their hips? Because I know there's some pretty cool stuff that you're doing these days.
Sure. So I do hips and knees to an extent. And that being said, how we try to keep your own joints, so without using artificial metal, plastic, things like that. So some of the things we could do are repairing the cartilage. We can use your own grafts or cadaver grafts or things like that to just try to keep your own cartilage. And when you have your alignments off, I basically cut the bones and realign them so that you're not putting as much pressure on certain parts of the bone, so that you can keep them for longer amounts of time and not needing a replacement at a young age.
Got it. That helps. It almost makes me think of like the bed of nails analogy. It's like if you have, if you try to lie on a bed of nails and your weight is distributed throughout all of them, you're okay, but you just put it all in one nail and you got problems.
Exactly.
So
That's
in
exactly what I
my
do. So then I
mind,
realign the bed of nails so that you have more surface area for the force.
perfect. That makes a ton of sense in my mind. I'm sure the actual process, looking at it, looks a lot different than what I'm imagining in my brain right now. But that's pretty cool, and I think I know for me as a therapist, and my colleagues, I always get excited when I can hear of things happening, within the surgical community where there's more and more being done to, like you mentioned, preserve the anatomy you're born with. Because I think, the longer that can last, as a good rule of thumb, the better. And it's really cool that you're sort of on like that cutting edge of, what's new that's coming out there, what's possible. And speaking of that, I know, are there, I'd love to hear, because I know you mentioned you were at Stedman Hawkins. I know they're doing some really impressive stuff, that you obviously know way more than me. So I'd love to hear from you, what things are happening, in your field, like different preservation techniques or otherwise, that are exciting you these days that, we're seeing a promising future with.
Sure. So as much as I love to do surgery, let's be honest, that's why I do what I do. I like to help patients avoid surgery as much as possible. Okay, so I think that non-operative treatments are just as important or more important than the surgical options that I can provide in my own hands. And with that being said, some of the new research that's coming out with biologics and injections, that is really fascinating to me. So I offer a lot of those options to patients, especially those that are the in-between patients that, may have a labral tear, but they're almost arthritic. And so you're sort of at this in between where one surgery might not work and the other surgery is not quite ready for you. And so I think biologics play a large role in that, when you're in between treatment options, or even just helping preserve your joint and prevent arthritis from happening. There's injections that we offer that can help that. And
Gotcha.
so some of the research I've seen at the Stedman Clinic or at Penn, that sort of pushed me a little bit in that direction, I think, just from my training.
That's awesome. I mean, that's really cool. And just to see, and I'm sure you've seen this. I mean, it seems like correct me if I'm wrong here. It seems like there's been just a lot of advancement in those kinds of areas. Like and of course, surgery is always going to be a necessary thing. But there's been so many advancements, I feel like, in recent years about some of the non-surgical options available to help people. And you obviously mentioned a few of them. Do you see that same rate of like growth and of new and exciting things happening, continuing moving forward?
I think so. And I think that has to do with technology, honestly.
Yeah.
So there's more and more collaboration between large practices and groups from one side of the country to the other. And so I think we'll see more and more collaboration with different groups so that we'll have more information and then we can use that to help patients better.
I love that. And I love that. That's so helpful. I mean, I could talk to you about this stuff all day, because it's super exciting. I'll save those questions for another time so other people aren't just totally bored of me nerding out here. But with that being said, like I said, for everybody watching this, Dr. Grossman's been a huge, valuable resource to us in McLean, and Bethesda too. So can't endorse her highly enough. And I mean, just that value of being able to get in on a Monday after a weekend. I mean, that's such a big thing that is just very rare these days. So with that being said, I'm going to put Dr. Grossman's contact information below the video here. And then Dr. Grossman, if you don't mind telling us, what is the best way to reach you, to contact you if I need your help?
The best way to contact us is at the Ortho Virginia McLean office. The front desk office you can find online. And that's the best way to make an appointment and the fastest way.
Cool. Yes. So exactly. So Ortho Virginia, look for the McLean office, look for Dr. Grossman. If anybody has any trouble, contact me. I'm sure we can troubleshoot it, but like I said, really easy to get in. The link and everything will be below the video. And most importantly, Dr. Russ, really appreciate you joining us today. And I know you're busy. This is one of many different types of videos you've had to make today. So appreciate you adding one more in for us and our audience here.
No, it's been a pleasure working with you, Zach. Thanks for having me today.
Oh, my pleasure.